Great to see so many people out on a cold night, come from different parts of Auckland. And then I remember people like patients who had diabetes. In my general practice training, you're taught to tell people with diabetes, prepare them that they're going to get worse over time, and they'll probably end up on, or half of them will end up on insulin. And I remember I kind of thought about this, and then I did it to a patient once, because in my GP registrar training, and I just remember their reaction was just horrific. It was, like it's, why aren't you going to cure me? Why aren't you going to treat me about, for this condition? Take some pills and I'll be okay. And yeah, I felt that sat really uncomfortably with me. And 2 or 3 years later, I came to New Zealand, worked with for people who don't know my story, worked with a doctor who knew about plant-based nutrition, was quite well informed about it. I was very skeptical at first. If you told me 10 years ago I was going to be a plant-based vegan advocate, I'd have laughed at you probably. And had to sort of swallow my pride and kind of, she was quite a strong person, I suppose, and I suppose an interaction of factors. I always wonder why people change to a plant-based diet. Everyone here's probably got their reason, type of person you are, or health issues you might have. Some people are interested in animals, the environment, but everyone's got their own health, hopefully, at heart. So I think hope for health is actually a really good thing, and that's what this diet, eating this diet. If you can get onto this diet, there is hope for you not to go down the route of the people I'm going to talk about as we go through this talk. So look, I'll jump through. I've got heaps of slides. Grant will have to haul me off as usual, because I'm quite passionate about it, and I've got to get that in. People have got to know about that. But feel free. Grant calls it a lecture, but I don't like the word lecture. It's a bit old school. Shout out, put your hand up, make a comment as we go if you like. I think we've got up to 40 minutes, but I'd like to address what people's concerns as we go, if we can. So a lot of people here will know that sort of the picture at the top right. Whole grains, fruit and vegetables, legumes, beans, chickpeas, lentils, fruits, nuts and seeds, etc. That's kind of the essence of what most people in public health and most health organisations are recommending at the high level these days. Now, there's other diets competing out there, and I'll come to those a bit later. But certainly, most public health professionals, the experts in this area and researchers are recommending centering your diet on those foods. So yeah, a few disclosures about myself. Peter sort of said already, followed a plant-based diet for a few years. I've done some Cochrane collaboration work, so that's kind of doing meta-analyses, sort of analysing the studies, if you like, work. It's a big organisation that is sort of top of the hierarchy of clinical studies, starting at case studies going all the way up to meta-analyses. So I've done a little bit of work. So kind of I know a bit about what, I'm not saying I know everything about everything by any means. We're all learning. This is a journey for me as well. But look, let's jump into it. And I gave a talk at World Health Day for one of the government organisations down south. Diets for health and planet are inextricable now, I think. I think to talk about a diet without taking into account environmental effects is, futile now. Looking at what's going on around the world, we've just been in the UK, they've had 40-degree heat wave, fires. We've seen what happens in Australia. The world's warming, and there's only really one pattern of diet that's going to slow that down. And a massive amount of our greenhouse gas emissions is due to our diet. 35% probably of our personal emissions. So it's a massive thing that we can do ourselves. And we've all got an interest in the environment or the future. So. And there's a few things here. I mean, it's hard. I'm working with a Pacific team in South Auckland. It's really, I look at what they eat, and these are people in the health business. And there are so many factors that go into what we eat. It's not just being told. I thought, oh, great. I know the cure to your diabetes, your heart disease, or whatever when I got into this area. And then obviously it's massively more complex than that. And I guess our mission is to try and get the information out. So Grant's angle, you're an angry man because you weren't told that you could have reversed your heart disease, and we'll come to that later. But We need to get some taxation in. We need to make it easier for people who want to follow a healthy diet to follow a healthy diet. So look, I'm going to jump in. I've got quite a few studies. I've got 5 good news studies to talk about, and then what I call some of the really cool stuff, which is disease reversal, because that's really cool. And when I was in the UK, I met people who are just doing this as their full-time job. They're seeing people for disease reversal, and it is really cool because it's really what I went into medicine for. Because we know we are the ambulance at the bottom of the cliff, rather than getting a fence at the top, because we're too busy just dealing with the day-to-day. I mean, the hospitals are overrun, understaffed. There's just too much demand. So I'll say a little bit about the problem in New Zealand. It's cancer and cardiovascular disease that kills most of us prematurely, and leads to several years of poor health before we get to that stage. Other non-communicable diseases, alcohol, smoking, etc. But diet is number one causative factor. Long-term conditions account for 89% of deaths in New Zealand. Massive costs of millions. 72% of New Zealanders aged 65 and older have at least one long-term condition, usually a lifestyle condition, and billions in externalised costs, time off work and healthcare costs. About a third of us are obese, and probably about 40% of us are overweight in the Western world now. Prevalence of type 2 diabetes in people over 40 in the UK, it's 10%, 5% overall in the adult population in New Zealand. And life expectancy has crept up gradually, but it seems to be plateauing now. It's sort of 81, 82 years. But if you look at healthy life expectancy, it's just stopping really. So women are living their last 12 and 13 years, and men their last 10 and a half years in poor health. So they say people are dying longer rather than living longer now. You know, you see people on multiple medications, multiple what we call comorbidities, you know, heart disease and diabetes and, gout and, all these other conditions. And they'll come in on sort of 6, 8, 10 medicines. It's an equity issue. Māori and Pacific are living 7.5 and 5.5 years shorter on average. And Europeans and Asians are living longer. So what are those risk factors? What are we talking about? What's been found? Well, in the health data info, they list them really. They do the analyses. Tobacco, overweight and obesity, high blood pressure, dietary risks, which I'll come to specifically what they are, high fasting glucose, alcohol, and a high LDL. So that's the artery clogging cholesterol that we try and get down in our patients. Unhealthy diets cause 20% of deaths worldwide, so that's about 11 million deaths a year. That's almost unfathomable, 11 million deaths. And those dietary risks, high in sodium, low in whole grains, low in fruits, low in nuts and seeds, low in vegetables, and the deaths there they cause. Mandy's going to talk about cancer, but a big contributor to cancer. But obviously what we call the cardiometabolic diseases, so cardiovascular disease, heart disease, stroke disease, diabetes. So what are Kiwis eating? Well, ultra-processed foods, you'll see them in the press more and more, UPFs, make up around 50% of calories in children by 12 months of age. Unbelievable, isn't it? And it gets worse with time. Only 53% of children consume 3 portions of veg a day. Salt is way up. They think we want 2 grams a day. People are averaging 9 grams. Causes high blood pressure. Blood pressure is the biggest contributor to heart and stroke disease. Fibre consumption is 15 grams a day. We're meant to have at least 30. And they think our original diet was probably more like 100 grams a day. And fibre is our number one dietary deficiency. And eating too much red meat and processed meat. I think that's the New Zealand, is it the MOH health plate? I'm pretty sure that one is, yeah. So obviously dairy is going to be in there in New Zealand. Canada have taken it out of their recommendations because there's no need for it. Yeah, and your protein source is there. They've got legumes and beans in there, which is good to see. Seafood and some of the lean meats, etc. But you see a big proportion of that plate are plants, the top and the left-hand side. So yeah, I mentioned the wider determinants of health. It's not always easy, you know, these factors that influence what people eat. So we're only a small organisation. You know, people are spending their entire careers. So Boyd Swinburne, the professor at Auckland, Population Health, spent his entire career, said it's made very little difference to people's health. You know, put all these publications out. And that's why he's focusing on just trying to get a few laws in, a few really hard rules, just because that will make the biggest difference. But there are so many factors that go into it. There's no blame to people acquiring health conditions as they go. My diet was pretty average, pretty crappy probably 10 years ago or more. You know, lots of processed foods sneak in. You know, meats, kind of, you know, higher saturated fat foods, high IGF foods, lots of dairy, lots of cheese. But just being aware of that, you know, it's not just about telling people. There's so many factors that go into what people eat. So, and I've given talks on this before. Lifestyle medicine at a personal level, you know, lifestyle medicine is this sort of movement really to try and address the causes of these conditions. So, you know, stress management's, you know, if you're stressed, it's very hard to do any of the other things on this page. If you're not getting enough sleep, that's secondary to it, relationships, etc. Tobacco and alcohol, you want to be having very minimal of those. The evidence for alcohol gets worse and worse, so came as a bit of a unhappy surprise really to Peter and me, who probably drank our fair share when we were younger, and I'm sure lots of other people did. Exercising, but nutrition, I focus on nutrition because if you can, what you're putting into your body, if you can get that right through whatever way you have to do it, then the other things can fall into place. Okay, so I'm just going to have a little talk about the best diet. So what is the best diet? What do people recommend worldwide? It's the US News and World Report annual best diets study comes out each year. So you've got 27 recognised experts in all these areas of nutrition and lifestyle medicine. And they calculate it based on several criteria they have. So how easy it is to follow is a big thing, obviously, because if people won't follow a diet, you know, it's no good. Weight loss in short term, long term, nutritional completeness, safety, if you like, diabetes management, because that's such a big problem, and its potential preventing and managing heart disease. And look, the Mediterranean comes out top for the last 5 years. And if you look at the top line of what's in a Mediterranean diet, there are lots of different types of Mediterranean diets. Some are higher fat, some are lower fat. But they emphasise eating fruits, veggies, whole grains, beans, nuts, legumes, some olive oil and herbs and spices, and some animal products there below in the wider sort of Mediterranean diet. And the best diet for heart health is the Ornish diet. How many people here know the Ornish diet? Have they heard of it? Okay, so just a smaller proportion probably. So Prof. Dean Ornish is sort of one of the pioneers of, he did the reverse heart disease studies, he's done reverse cancer studies. He's one of the pioneers of nutrition and lifestyle medicine based in the States. A lot around other factors. There's stopping smoking, exercise, stress reduction. I think he trained to be a yogi or something before he went into medicine. So he's got a big emphasis on that. But he's got a very low-fat diet, whole foods, plant-based diet, in a pure form. They used to allow a little bit of animal products, and now he's got rid of that. So it's whole grains, legumes, fruits, and vegetables in abundance. So yeah, reversing heart disease that's pretty cool. And the next best diets again: DASH, flexitarian, the TLC diets, and vegan diets in general. The Ornish diet was the top recommended diet by these top experts in the US. But there is a head-to-head. So Neil Barnard and his group, the PCRM group, have done a randomised crossover trial between the Mediterranean and a low-fat vegan diet, which is a whole food plant-based diet. And the vegan diet resulted in better weight loss, lower cholesterol, improved insulin sensitivity, so that's the basis of diabetes, and had less impact on blood pressure in this study. There aren't enough studies on whole food plant-based diets, vegan diets, but more and more are coming out, and I'll come to it in a minute. A lot of it's observational stuff, population data. So there's a few other good papers just to talk about. The Global Nutrition Report, so independent academics from all over the world and stakeholder groups from pretty major organisations. We're doing badly, so they recommend what diet globally people should be following to prevent malnutrition, but also stop obesity and diseases of dietary excess in the West. And it's all kind of bad news, unfortunately. We're all moving the wrong way. There's still in some countries malnutrition and stunting. 40% of all men and women, adults that is, are overweight or obese. It's 2.2 billion people. That is outrageous. And poor diets result in 1 in 4 deaths worldwide. 26% of all deaths worldwide, and about a third of those in North America and Europe, and a much smaller number in Africa. Fruit and veg below 50%, intake is 50% below the recommended 5 a day. Legumes and nuts well down, and unfortunately red and processed meat is rising in the developed world. It's recommended to have 1 serving a week, and people are getting 5 times that. And unfortunately sugary drinks are rising as well. So I see these people with these multi-litre bottles of Coke and Fanta and whatever, and it's not a good thing. This stuff's about the harm to the planet. 35% of all greenhouse gases are related to our food systems. But the good news is, the moment you go out and choose your next meal or go to the supermarket, you can change that.